Hi everyone, we were just live at 7 o'clock for our News 12 special report that we've been doing every night on the coronavirus outbreak. And tonight we had epidemiologist and Dr. Hassad with us, but you also have a mental health certification as well. Really interesting because I feel like just in the past 24 hours, we're seeing that everything's being shut down, no more sports, Walt Disneyland. I mean, it's like every minute something's being canceled, closed, and we're hearing more updates, of course, from the officials. So with that comes a lot of anxiety and a lot of fear that really I think is heightened, especially today after the announcement. So kind of talk to everyone about how to deal with that and really how to kind of bring us back to reality in terms of this literal outbreak and how safe we are or aren't.
Well, you mentioned anxiety,
Yeah.
and that's indeed the case, rather heightened indeed. And especially, I believe, after today's press conference, there is an added notch of anxiety.
Mm-hmm.
Although I found the press conferences quite reassuring in that the gravity of the problem is being identified and aggressive measures are being put in place.
Mm-hmm.
As I said earlier, social distancing is a necessary strategy to address this problem.
Yeah.
And what we saw in those press conferences was an emphasis given to that. We know it works. We have seen it work in China, in Singapore, and in South Korea. So we know it works.
Yeah.
So in that regard, although the message was sort of grim, it is moving in the right direction. Regarding anxiety, there are many models to understand anxiety. And the most evidence-based, I would say, is the cognitive behavioral therapy model that says our thoughts or the way we, or what we're thinking drives our emotions, and our emotions drive our behavior.
Yeah.
So what we need to look at is sometimes the thoughts we have are not supported by the evidence that exists. Like, this is a serious disease. I am going to get sick. I'm going to die. Well, there are different levels of risk. And we know that 80% of the people who become ill or who develop an infection, this infection, will have no symptoms or mild symptoms. So for some people, it wouldn't be a severe disease. So we need to think based on our risk category here and understand that in general, this will resolve for many. Along those lines, we need to sort of restructure our thinking or our thoughts. And that's what cognitive behavioral therapy does. But how do you do that? By getting the right information. So we need to pay attention to the news, valid information, and reliable sources.
Yeah, which helps. So kind of getting up every day and resetting your mindset almost,
It's definitely a mindset.
Yeah.
It's a mindset. Our thoughts drive our mindset. And our thoughts are influenced by information around us. So if the information is not reliable and valid, it could lead us to having dysfunctional thoughts. And thoughts that are really not supported by the evidence.
Thank you so much. I think a lot of people needed that, especially after the past day that we've had and really the tone. I think everyone's felt it all shift, which you say, yes, you felt it as well, but as someone who literally studies this, that we can be assured that this is in the right direction,
It
this
certainly
shift.
is.
Yeah. All right. Thank you so much for your
Thank you very
time.
much.
And stay with us here on News 12 for all the latest updates.